Hey everyone, thank you for joining us. Today is December 22nd. We're so close to the end of the year and most importantly to the Christmas holiday weekend. We've had so much going on, thankfully exciting things as well as some others with the vaccine, we were reaching new numbers, which is not so great. So Lee, tell us a little bit about what's going on. We have the good thing of the vaccine, but now we have these high numbers that we're having to fight against.
Yep. So the statistics today, we unfortunately hit a new inpatient high, 70 patients today between our three hospitals. That's the highest we've been. We've been running in the low 40s for a while, started climbing about a week ago. We've done over 53,000 tests with over 6,000 positives. Good news, the number of positives is down just a little bit. We're running about 38 or so, 39 7-day rolling average. So that's an indicator that maybe next week will be a little better. You know, we're concerned about what might happen 2 weeks after Christmas maybe. But the other concerning statistic is the number of open ICU beds. We only have one here in Pascagoula, I think 2 in Ocean Springs and 2 in Gulfport. And the state has been sending us people from Laurel, Macomb, Centerville, Mississippi. Central Mississippi is having an even harder time than the coast right now. And that's going to lead to what's called diversion or saturation, where hospitals in Central Mississippi right now, they can't take any more patients. So proud of our team and how we've been able to handle it. It's been tough, but we better buckle up because I think that we're going to have a little downturn and then it's going to swing back up just a little bit.
Yes, very grateful for our frontline heroes and those who make it happen behind the scenes to make sure that we can get patients in better and back home so we can take in the new influx of those from around our great state.
Yep.
And, of course, we had some vaccine news late last week.
We did.
Thankfully, exciting. We were the number one only on the coast to receive the very first Pfizer vaccine. And so we had 975 of those go out. And how's that going?
It's going great. By Christmas, what a great Christmas gift. We will have distributed almost every single one of those to our frontline clinicians, providers, technicians, and everybody who hopefully will have enough for every person here on the team that's interested in receiving that. And so we're excited about that. It is not a panacea. I've said that before, in that it's great that those people that will take care of you have been vaccinated and will not be out sick and can stay and take care of you. But the challenge is that the rest of the world does not have this yet. Right. And it could be late January or February even, maybe later, before it's in the hands of the general public. We will be here to serve you, and we are making plans to be one of the Phase 1A governmental distribution sites. So we're looking to help in any way we can vaccinate as many people in the community as want it. So we're looking forward to helping you all in that regard.
Yep, and that's why we have started a new campaign just last week. Hopefully you've all saw the commercial with Dr. Roth and some of the team members asking people to do what it takes.
Do what it takes. What is the, and I love it. Y'all have done a great job with that, Sarah. You and Shannon and Christina and the whole team have done a great job with our marketing efforts there and educating people. But so tell us a little bit more about what the
Right, so do what it takes. Yes, we have a vaccine, but we still need the public's health and help to get the spread started again as we see those numbers increase. So pretty much the same things we've been saying since day one, which is isolate, wash your hands.
If you feel bad, stay home.
Yes, and don't stop the visiting.
Stop the visiting. Wash your hands. Obviously, it's simple stuff. Wash your filthy hands. If you've not washed your hands in the last hour, go do it right now.
And also, we've included some things after talking to many of our providers, especially in the ER, that people are delaying their care. They're not making their doctor's appointments. They're not filling their prescriptions. They're not going to their follow-ups about their diabetes, their hypertension, the things that are chronic illnesses that if they don't take care of, they're not going to have a good outcome, whether it be from COVID or not. And so we really want people to just,
take care of themselves.
Self-care is really important, whether it be your mental health or your actual physical health.
I love how y'all laid it out. So there's things we need to keep doing. The hands, the close talking, all of that, avoid that. But then it's take care of yourself is kind of the second tier.
Right, because if you isolate at home, you still need to go to the doctor.
Take care of yourself. And then the third sort of new component you guys have, I really like.
Take care of each other.
Take care of each other.
I hope you all saw some of the videos that you posted of our Lights Luminaire Foundation event that we had that, is kind of encompasses like how we all take care of each other here, and that we are kind of lights in the darkness in our community. And so we kind of want to spread that same light with you guys, and that you can take care of your most vulnerable and elderly family members, especially this Christmas when you are tempted to go visit and to see them. No good deed goes unpunished. There's been case after
don't
case.
cause a COVID death. I
Right.
mean, I hate to say it so bluntly, but you go see someone who has it. If you've got a slight symptom and you don't feel the greatest, you should stay home, because you go to see your aunt or your grandmother or someone who has COPD or has a diabetes or an unknown kidney ailment or some issue like that, and they get sick with COVID. You're going to feel really bad if that happens. So please try to avoid that. As she said earlier, some of this is avoidable, but I love the take care of each other. And this is the time of year after Thanksgiving and going
2 more days.
It's almost Christmas.
Yes. So I think we are trying to, we know that people aren't going to change their plans just by watching this video, but we're hoping that we can at least put in the back of your minds that maybe it's not such a great idea.
Yep. If you love them, don't hug them. We've been saying that. And I think our big mantra this year is don't give COVID for Christmas. Give people something else. Don't give them COVID. That would not be a very good thing to give someone this year. And it's going to happen. I mean, it's no matter what we say, somebody watching this now is going to give someone else COVID. It's going to happen. But try your best to try to see if you can restrain yourself and avoid doing that. If you must go see someone, follow those things on dowhatiktakes.org. Follow those guidelines as best you can, and maybe that'll help some.
Absolutely. But, another one that's part of the Do What It Takes is pause the party and start the Zoom. So I know that a lot of places had to cancel their Christmas or holiday celebrations, not being able to get together. So, what's the difference of just putting on a Zoom or a Facebook Live like we have right now? There's a lot of great things out of technology that came through this year, and I think that's one of them.
Absolutely. And we really want to focus on that and educating people, pausing the party and thinking about the fact that our contact tracing educate people that it shows that the most likely place you are to get COVID time and again is from a friend, a neighbor, a sibling, a parent, someone like that. It's family members that you get it from. Right. I hate to say this, but if everybody went to work on Christmas, there'd probably be very little spread of COVID. And that's just, it is what it is. But you get this at social gatherings with friends, family, usually in your home.
Absolutely.
That's the most dangerous place.
When you let your guard down, when you take a swig of someone's beverage they want you to try, or you give them a hug, or you dance, or you sing together.
Yep, it can happen. So
yes.
Sarah found a good article. Maybe you can put that one on our Facebook or on our website or something about how even for kids get it in homes more than they do in school.
Right.
So that's something to think about. But
yes. So save the children. They're UMC and the CDC put together a nice study that showed that they're most vulnerable when they're at home and not at school.
So 2020's been a tough year, Sarah. I said the other day it was the best of times, it was the worst of times. And what I mean by that is there was a lot of bad, but there's a lot of good for us this year. We had our strategic partnership agreement that we entered into with Ochsner, which is going very well. Little by little, we have great expectations for what that is going to continue to bring to the citizens of South Mississippi. It's just great. And we were also able to invest in the property over there at Singing River Gulfport, a great, phenomenal property with a lot of good people. That I feel like we were able to save that property, and it's going to help our other 2 hospitals and our whole system to thrive into the future and serve the community over there as well. So those are 2 really best of times things. And on the worst of times, it's been a tough year. I think Jackson County exceeded 150 deaths today from COVID, and that's been bad. So best of times, worst of times, and hopefully going into 2021 we'll have more. But there's been some silver linings this year.
Absolutely. What goes up must come down.
Yep, been some silver linings, and I know you may think of some, Sarah, but I'll mention one: the drugs that have come out. To have dexamethasone, something that's been around for a long time, be so helpful in this fight. How thankful we are for seeing what that has done. The remdesivir that was developed at lightning speed. And then also, most recently, for outpatient therapies, we have the bamlanivimab, or the Bam Bam, that we've done over 70 treatments with that have kept people hopefully out of the hospital. Yes. So that's a silver lining. 2020
didn't show us that healthcare is a very innovative industry. I don't know what would And I know that has to do with the education, along with our community involvements, and then, of course, the testing in the lab, seeing all
testing is a huge silver lining. I think we're probably testing more than any other country. I know our system's testing more than any others, but that's a big silver lining, is testing ability to know what's going on has been
Yes, and it's been very inspiring to see the different areas come together, whether it be, Melissa and Community Benefit, or Jason and the clinics team, and Virginia and the lab team all coming together to have one solid mission, and that's to improve health and save lives and get people in and out and taken care of.
That's another silver lining. If I could say the biggest silver lining to me this year, it is our people. Our fearless warriors, as I like to call them, the grit and fortitude that they have had. They have risen up. They have worked since March the 9th, some of them with hardly a single day off, 12, 14-hour days in the worst of circumstances. And the silver lining that I see is we've seen the absolute best in those people. And it's been awe-inspiring to watch them in the midst of this turmoil. That's a huge silver lining, I think, more than any.
100%. And our core value number 2 is qualities in our DNA, which goes back to the drugs you just mentioned, the capabilities in testing, and also the new vaccine that we received this week. We never would have thought it would have gotten here this quickly.
That's a big silver lining. What did I say at the beginning?
From the very beginning, Lee always said, is the world going to end, Lee? No, this is America.
We figured things out in America, and here we are with a vaccine in lightning speed, so that's really a super big deal.
Yes, and so whenever it comes out to the public, we'll be here to help administer that to you guys, and to also, support you guys into getting it, because we want to avoid a lockdown like we see our friends over in England having to do right now over the Christmas holiday.
We are anti-lockdown, and the way to avoid that is educate, do what it takes, go to dowhatiktakes.org and do those things. But anyway, well, Merry Christmas. If we don't talk to you again before then live, and I have to, in the words of Pitbull, we're going to lose some battles, but we're going to win the war.
Yes, sir, and we're all going to stay singing River Strong.
Do it.
I need you right now.